And I got lost in my thoughts there a couple times. Hi, I'm Dr. Gary Motykie, and I am a board-certified Beverly Hills plastic surgeon. And today we were going to go through Katie Price.
Part 2.
So I think the last round of Katie's surgeries, you know, in 2020, 2021, she was in her late 30s, maybe even getting close to her early 40s. And now there's a combination of things going on. I think, you know, psychologically, patients are getting a little bit older. They've already undergone surgery. They want to do more and more and more. It's almost slightly addictive. And at that point, patients need to pull back and say, is this really what I want? Because a lot of it, when you get extreme, you can't undo it. You can't put skin back. You can't put certain features back once they've been removed, such things like the cat eye look and the extreme facelifts, the lip lifts. Surgeries that are removing that skin and lifting and pulling things, it's very difficult to put that back. So sometimes they'll want to go back, but they can't. So they just kind of try to do more or try to mask it with other surgeries. And I think we start seeing that in her. I just warn patients that at that point, the risks go up. You don't really want the extremes of plastic surgery. And then we're kind of spilling over into the world of what is the difference between too much surgery and like a body dysmorphia, or something wherein there really isn't anything wrong, but the patient sees something wrong and they want more and more surgery.
Another thing, I'm not addicted, but it's out there. And if I feel like I'm freshen it, I will. If people want to say I've got body dysmorphia and that, just say it. Even my mum says it, you need to see somebody. You're not normal in the head, are you, Kate?
In that case, it's even worse because the answer is not surgery in that case. The answer is to seek help for that patient, to tell the patient maybe this surgery is not right for you right now. Maybe you need to reassess what you're trying to achieve and get them psychological help. And it doesn't hurt to even broach that topic, because as a doctor, your job is first to help the patient and be the patient's advocate. And in this case, I'm not saying that she doesn't like the way she looks. I'm just saying it may be something that should come up in conversation at some point when things are getting super extreme. And I think that's another little caveat I have to say about surgery in Turkey, or any country for that matter, is why are you going there? Why are you pursuing surgery there? Is this the center of excellence? Is this the best surgeons in the world? Is this why you're going there? Or is it more for they're doing extreme results and it's a little bit of bargain pricing and I'm going there for a deal? In that case, again, it can be a little bit of a problem, because once you're there and get the surgery, you can't undo it. I warn patients again, maybe don't seek those extreme results and that bargain shopping, because I do see patients coming here after going to places like Turkey and they want to undo the surgery, but they can't. I think people need to know that before going in, because they may not hear, well, if you don't like it, you can't reverse it.
And also that we don't see a lot of fully healed Turkish surgeries, right?
Yeah, exactly. I mean, as far as seeing the results on the table, sometimes the opposite. They're seeing those extreme results on the table and they're like, oh, it looks kind of nice, but they don't see what it looks like in the end result. And that's one of my pet peeves about patients knowing, because like this case, it's undoable, right? So when they do that extreme nose or that extreme cat eye or that extreme lift and it looks kind of cute and great on the table, 6 months later, a year later, it looks totally strange and overdone, hard to fix.
Yeah, I think that what our intention is to clarify that it's not this like all-encompassing warning, don't go to Turkey for a rhinoplasty. It's know what you're getting into and what those results you're seeing on Instagram or TikTok or whatever will potentially be like a year from now.
Right. Like this case, they'll do the surgeries there and then they'll go back for a tweak and another tweak, and because it wasn't exactly what they wanted, they think more is the answer, and really it's not.
Now, when I went to Turkey, I've been to the place before, comfort zone before.
Sometimes no is the answer or less is the answer. I just wanted to touch a minute on body dysmorphia, because I think it's one of those things that in my world or in the world of plastic surgery, a lot of people talk about, like, why do people want to look weird? What's going on with them?
And I definitely don't want to have that alien look. You know, when you could see some people have gone over the top and they look like freaks.
And they throw that term out there. What does it actually mean? And also, when does a doctor say is enough, you know? And I think it gives these type of extreme results and extreme surgeries give plastic surgery a bad name. They think that that's normal. A lot of patients will come in saying, I don't want to look strange or pulled or different or weird, and they see these extreme results because they're brought up in the media and posted everywhere. But that's not the normal. Majority of all patients want to look normal. They just want to look like themselves, a little more rested, a little younger, a little prettier. They don't want these extreme results. So I don't want to scare people by talking about this, but on the other hand, if you feel these sort of tendencies, you may want to ask these questions and also steer yourself away from getting stuck in these situations. And I think as a plastic surgeon, one of the things that I'm in the room was, how am I feeling? Am I getting a bad feeling about this? Are things seem off? Does it seem extreme? Something just doesn't seem right. These sort of warning signs and bells go off. You have to try and think, okay, maybe surgery isn't right for this patient, and tell them no. For me, personally, I think cosmetic surgery, aesthetic surgery should be about making a patient look more beautiful, not extreme, outside of society, causing regret, causing anxiety about what they've done to themselves, because that's exactly the opposite of what you want out of plastic surgery. You want people to feel more confident, more accepted. I think that when we see these doctors doing these type of surgeries, we have to ask, why are they doing these things? One thing that's important is, I would guarantee this type of a patient, or a patient like Jocelyn Weidelstein, is that
I don't know the right way to say it, but yes. Yeah.
They're doing these extreme things, and I think that those type of results can be scary for people. It can be too much, and I think that people need to understand that this is going to give plastic surgery a bad name, and also be risky, and that they should steer away from doing these extreme things. It reminds me also of patients like Michael Jackson, continually do more and more surgery, but still aren't looking more normal, they're looking more abnormal. So, those are the things I think when doctors should intervene. It's sort of like anorexia, different sorts of bulimia diseases where patients think they're heavy, but they're not. And, the answer in those patients are not to do liposuction, right? It's not to do surgery, it's to get them help. And it's very similar in this situation, whereas the answer isn't surgery, the answer is maybe helping them deal with what's going on in their lives and deal with their psychological issues before undergoing the knife in a risky procedure. I would hope that that's something that's done, but we can see that in certain instances it's not being done. And I don't know where those ghost surgeons are, what's going on out there, but just as far as the warning lights go off for you, not saying this is happening to you, but if a doctor's or a lot of doctors are telling you no, and you're getting multiple suggestions when they're saying maybe this isn't right, maybe this will make you look a little too extreme, or this is too risky, just heed that advice and understand maybe that doctor's trying to help you. In this world, the good doctors will eventually say no. And we've talked about this before. The problem is the ones that aren't going to say no. And that's where I was getting to with the Jocelyn and the different patients that are extreme, is that I call them kind of ghost surgeons, right? Who is their surgeon? All of these extreme results, we never hear the names of these doctors. We don't know who they are. We don't know where the work's getting done. We have no idea about it. That's partially for two reasons. One, they may not want to say who they are. But secondly, in my mind, is people have to realize that this is probably or almost 100% unlikely to be a board-certified plastic surgeon or somebody that's an experienced, well-qualified surgeon doing this. And the reason is we're held to a little bit higher standards. We have, whether our societies and our boards, they have ethical standards, moral standards, things we can't do. And some of those first things are these sorts of things. Is this harming the patient? Is this really making the patient happier and a better life? And those are really gray areas in this world. But in the world of plastic surgery, if you're breaking the standards of care, going against what may be standards in the community, these things can get you in trouble as a board-certified plastic surgeon and the societies we belong to. So a lot of times you're not going to hear these backroom ghost surgeons that are doing these procedures, because they're most likely not a board-certified plastic surgeon or members of these major societies, because they get kicked out for doing that type of work. I've tried to look up the certification process there, the standard. I'm not saying it's bad, I'm not saying it's good, it's just difficult to navigate through these different countries and what is their standards for care and their standards for training and certification. They can be very different, and again, not saying it's better or worse, but just do your homework and know that before you travel abroad to do your surgery in a foreign country.